I think you're right. I mean, there will be some people who are not eligible for subsidies or Medicaid, as is the case today. But I think that, the federally qualified health centers, the public hospitals, will still be there and still get support in order to, cover them. On the broader issue you raised, for people who do need help in, navigating the healthcare system, knowing where to go to get care, and also knowing what services they should be getting on a preventive basis. I think there are some strong steps that are taken. One that I think is particularly strong, and I was looking at it last night, in fact, is a provision that would give states the option to cover nurse home visitation for pregnant women and families with very young children. These are programs that are actually evidence-based. They've been proven to be effective in improving outcomes for pregnant women and for young children, and also in preventing child abuse. And they do exactly what you say. Trained nurses go into homes and talk to pregnant women and young mothers about the care that they need, the care they should be getting, how to stay healthy, and how to deal, with young children in a way that increases the possibility of positive outcomes. So this will be an option for states. They won't have to do it, but I think it's a very, very positive step in the House bill.
And this is basically for the adults. Children, for the most part, are going to be covered by SCHIP.
They will be covered either by Medicaid or now actually folding into the new insurance exchanges, where they'll get coverage with their parents. I mean, that's really the good news. The whole family will be covered, not just the children now. And I think we've done a great job with children, but we all know that children live with their parents.
Yes.
And if their parents are not doing well, if their parents are uninsured and experiencing high health care expenses, that obviously affects the entire family. And if a young mom is depressed, she's not going to take the best care of her child. So this is an extremely positive step to get low-income families, the entire family, covered.
You brought up something else with the emotional health. How does it deal with mental illness?
I think there's coverage. I mean, I think in the essential basic benefit package, now none of the bills have, real specifics on, exactly what will be covered. They all look at broad categories and leave the actual design for a later date, which makes sense, so we don't get caught up in deciding whether, a very specific service will be covered or not. But within those broad categories, the bills would cover mental health and substance abuse treatment. In my area, when we started noticing a lot of homeless people was after the lawsuit, when the court decided that a patient has a right to treatment. And there were a lot of state facilities were just simply housing the people, and they all got discharged. Right.
And many of them got discharged with prescription medications, but when they ran out, they didn't go to get them refilled, and they end up homeless on the street. And that was kind of the beginning of my knowledge of homeless people, which pretty much occurred all over the country about the same time. Is there a provision for any follow-up care? Does that take place in the community health centers, or?
Yeah, I mean, I think the most exciting, I spoke right at the beginning about this provision that would cover adults without children, very low-income, poor adults without children. This is where we're going to be able to bring those homeless people into the healthcare system. And they will be in the Medicaid program, which has a benefit package that is designed especially for low-income people and people with chronic illness and chronic mental illness. And this is, I think a real step up, because state Medicaid programs have developed, along with community mental health centers and providers, treatment that really works, that kind of wraps around social services, rehabilitative services, supported housing. All of it isn't paid for by Medicaid, but has really come up with ways that have been shown effective in keeping people out of the hospitals and improving their overall functioning and allowing them to get to work. So I think by bringing people who have never been able to get coverage into the coverage system, there's real new opportunities to get them so they're not homeless, essentially.
Now, if we get all this passed into law, it's not going to be perfect the next day. It's going to take a while to phase it in. All the provisions get implemented right away.
You're right. I mean, there will be definitely some tweaking that will have to be done over time. I think it is not a totally on day one, although, you know, the eligibility for these new benefits will begin on day one. Clearly, in designing the implementation, we'll have to have a way to make sure it doesn't, that transition is smooth. You know, we certainly saw in the Medicare Part D implementation that you need to be really careful in planning so that the system is not overwhelmed. But a lot of some of the insurance reforms, particularly those affecting employers and so on, will be phased in probably over a 5-year period. So I think, and a lot of that will be left to the Secretary of Health and Human Services, to this new agency that will run the insurance exchanges, to spell out the details and how to get that done. And clearly Congress will have to come back and make fixes probably every year for quite a period.
Well, one last question, because our time is getting short, but I'm still trying to understand why the insurance companies seem so threatened with a new way of getting health care to more people.
I think, you know, it's hard to say, you know, given the numbers. You know, I'm not going to, I can't really speak for them. I wish I had a window into them, but they, you know, they do see this as competition. It is, you know, going to be a cheaper plan. It is going to be more efficient because of the ability of government to, you know, bargain with providers. And I think they're just a little worried that it will cut into their business. If they can compete, and there's no reason to think they can, they should be fine. And that's certainly what we've seen in the Congressional Budget Office findings on the bill. So I think it is a little overstated.
What do we have now that we didn't have 15 years ago that would be a bit more convincing to the general public that this needs to happen?
We have a really strong children's health insurance program that really came out of the, you know, the inability to get major health care reform in 94 or 3. So in 97, Congress passed the children's health insurance program, and it was reauthorized this year, and it has proven to be a very strong and popular program. It is a public program. It has enrolled millions of children, but it also has focused attention on getting children covered in its companion program, the Medicaid program. So I think we've seen success in expanding coverage, and it's time to build on that.
Well, thank you very much. Our time is over, but this is an interesting thing to me because there are a lot of questions that I have for various industries that seem to be so upset about this, and I don't see the reason why it should be. But thank you for watching, and we'll see you next time. Hopefully we can get more and more answers about the health care plan.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.